Hello there. Welcome to Brainetainment, your one-stop channel for easy-to-understand health and wellness information. Here on Brainetainment, we strive to break down complex health topics, making them accessible and digestible for everyone. Whether you're seeking to understand your body better or simply curious about the world of health, you're in the right place. Don't forget to hit that subscribe button for more insightful content. Today we delve into a prevalent health issue: arthritis. Brace yourselves for an enlightening journey into the world of joint health. Arthritis, a term you've probably heard, but what exactly does it mean? Arthritis, at its core, is an inflammation of the joints. It's not just a single disease, but rather a way of referring to joint pain or joint disease. There are over 100 different types of arthritis and related conditions. While many associate arthritis with old age or general wear and tear, it's critical to understand that it's much more than that. This condition can affect anyone regardless of age. Even children can be diagnosed with certain types of arthritis. Yes, it's that widespread. The commonality among these many types is the impact they have on our joints, those critical connections between our bones. They may cause pain, stiffness, swelling, and changes in shapes of joints, over time affecting our ability to carry out everyday tasks. Now that we know what arthritis is, let's explore its different types. Osteoarthritis, also known as OA, is the most common type of arthritis. Let's dive into what exactly happens to the joints in OA. Imagine a healthy joint where the ends of each bone are capped with a layer of smooth, shock-absorbing cartilage. Now, in the case of osteoarthritis, this cartilage begins to wear away over time. As it wears, the bones underneath may thicken and broaden, causing bony growths or spurs to form. The bones can eventually rub together, causing discomfort, stiffness, and sometimes pain. Now you may ask, what triggers osteoarthritis? Well, it's often a combination of factors. Age is one of them, as the likelihood of developing OA increases with age. Gender also plays a role, with women being more prone to OA, especially after menopause. Obesity is another risk factor, as carrying extra weight puts additional pressure on weight-bearing joints like the knees and hips. Moreover, genetics, previous joint injuries, and certain occupations that involve repetitive stress on a particular joint can also contribute to the onset of OA. So what does osteoarthritis feel like? The symptoms can vary from person to person, but common signs include joint pain during or after movement, stiffness after periods of inactivity, tenderness when light pressure is applied to the joint, and a grating sensation or popping noises when the joint is in use. As for treatment, there's no cure for osteoarthritis, but the symptoms can be effectively managed. Lifestyle changes like maintaining a healthy weight and staying active can help to reduce joint pain and keep mobility. Pain relievers and anti-inflammatory drugs can also be used to manage symptoms. In severe cases, surgical procedures like joint replacement or joint fusion may be considered. That's osteoarthritis for you. Moving on, we have another common type, rheumatoid arthritis. Rheumatoid arthritis, or RA, is a type of inflammatory arthritis. It's an autoimmune disease where the body mistakenly attacks its own tissues, in this case the joints. The process starts in the synovium, that thin layer of tissue lining the joints. The immune response leads to inflammation, causing the synovium to thicken. Over time, this inflammation can damage the cartilage and the bones themselves, leading to joint deformity and loss of function. Let's talk about risk factors. Anyone can develop RA, but certain factors can increase your risk. It's more common in women than men, and it often starts in middle age, though it can occur at any age. Genetics play a role too. If a family member has RA, you may be more likely to develop it. Environmental factors such as smoking or exposure to asbestos or silica can also up the risk. Now, onto the symptoms. They can vary, but often start with a tender, warm, and swollen joint. Usually it's the smaller joints that are affected first, like those in your fingers and toes. As the disease progresses, symptoms may spread to the wrists, knees, ankles, elbows, hips, and shoulders. Many people with RA also experience fatigue, fever, and weight loss. So what can be done about it? Well, the goal of treatment is to minimize symptoms and prevent joint damage. Medications such as NSAIDs, steroids, and disease-modifying anti-rheumatic drugs, or DMARDs, can help reduce inflammation and slow the disease's progression. Physical and occupational therapy can also be beneficial to keep joints flexible and learn ways to protect joint integrity. In severe cases, surgery may be necessary to repair damaged joints. That's rheumatoid arthritis. Now let's look at a lesser-known type, psoriatic arthritis. Psoriatic arthritis is an autoimmune disease often associated with the skin condition psoriasis. Just as the name suggests, it's where two conditions intersect, creating a unique set of symptoms and challenges. Now, what exactly is the link between these two? Psoriasis, a skin condition characterized by red, scaly patches, is a mainstay for about 30% of individuals who eventually develop psoriatic arthritis. So you can think of it as a bit of an unwelcome tag-along. Now, what are the risk factors for this arthritis type? Well, if you have psoriasis, your risk is already elevated. Family history also plays a part, as genetics can predispose some individuals to both conditions. Certain environmental factors and specific immune system triggers can also increase your risk. So, what does psoriatic arthritis feel like? The symptoms can be quite varied, but common ones include joint pain and stiffness, especially in the morning, swelling in fingers and toes, and general fatigue. Some people may also experience changes to their nails, like pitting or separation from the nail bed. It's also important to note that symptoms can come and go and vary in intensity. Now let's talk about treatment. Psoriatic arthritis is a chronic condition, meaning it's here for the long haul. However, that doesn't mean it can't be managed. Treatment usually involves a combination of medication to reduce inflammation and slow disease progression, physical therapy to maintain joint flexibility, and lifestyle changes like exercise and a healthy diet. In some cases, surgery may be necessary to repair joints damaged by the disease. Remember, if you suspect you might have psoriatic arthritis, it's crucial to seek medical advice. Early detection and treatment can help manage symptoms and prevent further joint damage. That's psoriatic arthritis. Now let's wrap things up. So we've learned about 3 common types of arthritis today: osteoarthritis, rheumatoid arthritis, and psoriatic arthritis. Each of these types of arthritis has its own unique characteristics, but they all share one common feature: inflammation of the joints. Let's quickly recap. Osteoarthritis, often referred to as the wear and tear arthritis, is the most prevalent type. It occurs when cartilage, the cushioning tissue within joints, wears away. This causes bones to rub against each other, resulting in pain, stiffness, and loss of movement. It's a degenerative condition, meaning it worsens over time, particularly affecting the hands, knees, hips, and spine. Next, we discussed rheumatoid arthritis. Unlike osteoarthritis, which can be due to age or injury, rheumatoid arthritis is an autoimmune disorder. This means that the body's immune system mistakenly attacks its own tissues, in this case, the lining of the joints. This leads to painful swelling, which, if left untreated, can progressively result in bone erosion and joint deformity. It's a systemic disease, meaning it can affect the entire body, not just the joints. Lastly, we looked at psoriatic arthritis, a type of arthritis that affects some people who have psoriasis, a skin condition characterized by red patches of skin topped with silvery scales. In psoriatic arthritis, not only the joints, but also the areas where tendons and ligaments connect to the bones become inflamed and painful. It's also associated with other symptoms like fatigue and reduced range of motion. All these types of arthritis can significantly impact a person's quality of life. But there's a silver lining. Early detection and treatment can help manage the symptoms and slow down the progression of these diseases. It's crucial to consult with a healthcare professional if you experience persistent joint pain or inflammation. Remember, each of these conditions is unique, and so are their treatments. The key is to understand your body, listen to its signals, and seek help when needed. Don't let arthritis slow you down. With the right knowledge and care, you can continue to lead an active and fulfilling life. We hope you found this enlightening. Remember, knowledge is power. Stay informed, stay healthy. From us at Braintainment, thank you for watching. Don't forget to hit that subscribe button for more insightful content.